My name is Zachary Fricker. I am the Clinical Pharmacist Fellow at Aegis Sciences Corporation. Thank you all for attending today's webinar on prevalent adulterants found in the illicit drug supply. The following material is not authorized for reproduction without expressed written consent. Today, we will be discussing prevalent and emerging adulterants, xylazine, medetomidine, BTMPS, and phenylbutazone. We will review trends in adulterant emergence using internal and external data, highlight the illicit substances with which they are found with, and examine associated risks in the illicit drug supply. Those who missed the live presentation or would like to hear it again may find a recording of this presentation on the Aegis website, and please call 1-800-533-7052 if you need assistance accessing the recording of this webinar. Adulterants are unreported substances added to a product, often to reduce production costs, enhance the product's effects, and may increase the severity or likelihood of adverse events associated with illicit drug use. These substances span a wide range of pharmacological categories. While they are most commonly found in combination with illicit drugs, some adulterants have also been detected on their own. In 2024, the most prevalent and emergent adulterants at Aegis included xylazine, medetomidine, phenylbutazone, and BTMPS. These and other substances are categorized under the NPS Other class within Aegis's Novel Psychoactive Substances testing menu. Our NPS testing enables us the ability to conduct real-time monitoring of emerging adulterants, supporting timely public health responses to evolving drug threats. Xylazine is an alpha-2 adrenergic receptor agonist approved for use as a sedative with analgesic and muscle relaxant properties exclusively in veterinary medicine. Its active metabolite is 4-hydroxyxylazine. Xylazine is not a controlled substance and as such is not tracked by state prescription monitoring programs. Several branded products contain xylazine, including Anacid and Xylomed. On the street, it is commonly referred to as Trank or Trank dope in the United States and as Anesthesia de Caballo in Puerto Rico. The Drug Enforcement Agency's analysis of over 40,000 illicit drug samples found the top 5 illicit drugs adulterated with xylazine to be fentanyl, heroin, p-fluorophenol, cocaine, and methamphetamine. Additionally, xylazine co-positivity in fentanyl powder and fentanyl tablets showed a 3-fold and 5-fold increase from Q1 of 2020 to Q4 of 2024, respectively. The use of xylazine as an adulterant in the illicit drug supply is believed to have first emerged in Puerto Rico in the early 2000s and later appeared in Philadelphia, Pennsylvania in 2016 within the continental United States. In 2021, xylazine was reported in over 90% of the fentanyl samples tested in Pennsylvania. As of 2024, the DEA found reports of xylazine in all states within the U.S. except for Wyoming. This graph here illustrates the positivity rate of xylazine. The data presented here and in the subsequent graphs are calculated as the number of positive results divided by the number of class orders per month multiplied by 100 over the specified time frame. Since 2023, xylazine has consistently been the most prevalent adulterant and the most frequently detected NPS at Aegis, regardless of drug class. Although data for Q1 of 2025 has not yet been compiled, xylazine positivity rates have shown an increase in each quarter of 2024, underscoring the importance of comprehensive definitive testing strategies to stay ahead of emerging NPS detection trends. Xylazine is associated with numerous serious adverse effects, including sedation, central nervous system depression, respiratory difficulty, and death. Additionally, repeated xylazine use is linked to chronic skin wounds such as ulcers that are susceptible to infection and in severe cases may necessitate limb amputation. The danger of xylazine is significantly heightened when combined with opioids, as it can amplify their sedative effects and greatly increase the risk of fatal respiratory depression. It may also intensify or prolong illicit drug effects, leading to synergistic toxicity. A study conducted by the CDC, which analyzed data from the state unintentional drug overdose reporting system, found a rise in overdose deaths involving illicit fentanyl adulterated with xylazine, increasing from 3% in 2019 to 11% in 2022. Although naloxone does not reverse the effects of xylazine, it is still recommended to be administered in suspected overdose cases given xylazine's frequent adulteration of opioids. Treatment for xylazine intoxication should focus on supportive care, particularly respiratory and cardiovascular stabilization. Chronic xylazine use can lead to dependence and withdrawal. Reported withdrawal symptoms include anxiety, panic attacks, and elevated heart rate and blood pressure. Medetomidine is a synthetically manufactured alpha-2 adrenergic receptor agonist used exclusively in veterinary medicine as a sedative, muscle relaxant, premedication, anesthesia adjunct, and analgesic. It exists in two enantiomeric forms, dexmedetomidine, which is approved for both veterinary and human use, and levomedetomidine. Medetomidine's active metabolite, 3-hydroxymedetomidine, also contributes to its pharmacological effects. Medetomidine is not classified as a controlled substance and therefore is not listed in the state prescription monitoring programs. Several branded products contain medetomidine, including Domitor and Zen Alpha. It is colloquially named on the street as Rhino Trank. Medetomidine belongs to the same drug class as xylazine, but is 200 to 300 times more potent. Medetomidine was first reported as an adulterant in the illicit drug supply in 2021. It is most commonly found in illicit drug samples containing fentanyl, heroin, and xylazine, although it has been identified in combination with more than 15 other substances. According to the DEA, from 2021 to 2024, medetomidine and its analog, dexmedetomidine, had been co-reported with various illicit drugs, including designer opioids, cocaine, synthetic cannabinoids, and methamphetamine. Reports of medetomidine as an adulterant in the illicit drug supply have come from 13 U.S. states such as Florida, California, and Colorado, as well as parts of Canada. Its increasing prevalence is evident from the DEA data, which reported 12 illicit drug submissions testing positive for medetomidine in 2021, which rose sharply to 262 in 2022. As of 2023, 208 submissions have been reported, with final numbers expected to grow. This graph illustrates a dramatic surge in medetomidine prevalence in 2024, with 97% of positive samples also containing xylazine. As medetomidine's presence increases, it is essential for healthcare providers to be aware of the associated risks. Providers should consider including medetomidine in routine drug screening panels and review patients' hospitalization history for medically administered dexmedetomidine, as it may cause a positive medetomidine result. Reported adverse effects of medetomidine include sedation, hallucinations, hypotension, and bradycardia. In cases where medetomidine had been identified as an adulterant in illicit drugs, increased severity of adverse events and prolonged drug effects have been reported. The adverse effects related to medetomidine are also reported to last longer than those associated with xylazine. Additionally, while sharing similarities with xylazine, medetomidine has not been definitively linked to the chronic skin ulcers commonly seen with xylazine use. During an opioid overdose, the effects of medetomidine are not reversed by naloxone, although reversal agents such as tipimazole and yohimbine exist. Their safety and efficacy in humans have not been adequately studied. The treatment of medetomidine overdose should focus on supportive respiratory care and blood pressure management. This graph here illustrates the positivity rates of both medetomidine and xylazine. Due to their similarities, medetomidine is used similarly in veterinary medicine, while dexmedetomidine is used both in human and veterinary settings. Data from the DEA suggests that medetomidine has the potential to supplement or replace xylazine as an adulterant in the illicit opioid supply. However, the combined 219 medetomidine and dexmedetomidine laboratory submissions are minimal compared to the 17,332 xylazine submissions reported in their 2023 National Forensic Laboratory Information System drug data. Our most recent additions to MPS adulterant testing, added in December of 2024, include phenylbutazone and BTMPS. Phenylbutazone is an NSAID formerly used to treat conditions such as arthritis and gout in humans. However, it has been discontinued for human use in the US and is now approved only for veterinary use. Oxyphenylbutazone is its active metabolite. Several branded products contain phenylbutazone, such as Prevalent and Butatron, and it is colloquially named on the street as Bute. Phenylbutazone is most frequently found in illicit drug supply containing heroin, fentanyl, and designer opioids, but has also been found in samples containing cocaine, xylazine, and other adulterants. A literature review reported that phenylbutazone was found in 116 illicit drug samples in Pennsylvania from 2016 to 2021, signaling a growing presence in the illicit drug supply. Adverse effects contributing to the discontinuation of phenylbutazone for human use include gastrointestinal bleeding, liver and kidney damage, blood disorders, and reports of death. Long-term use has been associated with hepatitis, kidney failure, and congestive heart failure. Serious blood disorders linked to phenylbutazone include agranulocytosis, leukopenia, thrombocytopenia, and aplastic anemia. Symptoms of toxicity may include rash, blurred vision, nausea, vomiting, diarrhea, edema, abdominal pain, and others. If phenylbutazone is orally ingested, treatment options such as gastric lavage and activated charcoal may be effective. BTMPS is an acronym for its chemical name, bis-2266-tetramethyl-4-piperidylsebacate, is also known by the trade names Tenuvin 770, HAL 770, or T770. BTMPS is one of the newest emerging adulterants identified in the illicit drug supply as of June of 2024 and added to Aegis testing in December of 2024. Animal studies have shown that the mechanism of action of BTMPS is a potent L-type calcium channel blocker and a non-competitive nicotine receptor antagonist. Unlike previously discussed adulterants, BTMPS is not approved by the FDA for any use. It is commonly used as a light stabilizer in a wide range of consumer materials, including plastics, paints, sealants, and packaging. Given its widespread use in these materials, a positive drug test result for BTMPS, particularly in cases where other illicit or unexpected substances have not been identified, should prompt consideration for all potential sources of exposure. BTMPS has been detected in the illicit drug supply in substances such as fentanyl, synthetic opioids, stimulants, medetomidine, and xylazine. Analysis of 98 illicit drug samples revealed that in 63% of cases, BTMPS made up more than half the total volume of the substance. Additionally, unlike other adulterants, BTMPS has not emerged from a single location and spread outward. Instead, it has appeared simultaneously in multiple states across both the east and west coasts of the U.S. Animal studies suggest that BTMPS may cause several adverse events, including cardiotoxicity, ocular damage, sudden death, and nicotinic antagonist effects. According to a manufacturer's safety data sheet, BTMPS is also suspected of damaging fertility or the unborn child, is highly toxic to aquatic life with long-term effects, and may cause skin irritation. First aid measures vary depending on the route of exposure. In cases of unconsciousness due to inhalation, the patient should be placed in a stable side position for transportation. If the substance comes into contact with skin, it should be washed off immediately with soap and water. In the event of eye exposure, rinse the affected eye thoroughly with running water for several minutes and consult a doctor. If the substance is swallowed and symptoms persist, seek medical attention. To conclude today's webinar, I have created a graph using Aegis data from Q1 of 2024 to March of 2025 that illustrates the positivity rates of all adulterants discussed today side by side. While xylazine remains the most prevalent adulterant, it is essential not to overlook the others. Each adulterant discussed today has shown or is beginning to show an increase in prevalence. It's important to note that the data presented here reflects only a portion of actual exposure, as many exposed individuals may go untested. These adulterants carry significant clinical risks and can lead to severe health outcomes. This underscores the urgent need for comprehensive, definitive testing solutions to stay ahead of emerging trends. By advancing our testing capabilities, we equip healthcare providers with the tools necessary to detect and respond to the evolving landscape of substance use. Lastly, I would like to share with you the contact information for my colleagues and I. Our clinical team are available to provide extensive services to our clients, such as result interpretation, clinical education, and individualized practice-level trends and analytics. You can access this webinar, the published clinical update, and past sessions by visiting the Aegis website under the Clinical Resources tab. That will conclude today's webinar. Thank you all so much for your attendance, and I hope you have a wonderful rest of your day.